Hello, my name is Linda Southward, and I'm the director of the Children's Foundation of Mississippi. We are so pleased to offer a series of chats about children, discussing the important issues impacting children and youth across Mississippi. Today, we're delighted to have Andrea Sanders, who serves as Commissioner of the Mississippi Department of Child Protective Services, having started in this role in 2020. In 2005, she completed a Juris Doctorate at Mississippi College School of Law while raising two small boys. After graduating, she worked as an attorney in private practice and for the judiciary prior to joining the team at the Mississippi Department of Human Services. Andrea also holds a master's degree in social work from Tulane University, has worked as a clinical therapist with families, children, and adolescents, and as a hospital administrator in both the public and private sectors. In addition to being a wife, mother, and community volunteer, she has also exhibited a lifelong commitment to learning through work as an adjunct professor at Jackson State University's School of Social Work, the University of Southern Mississippi School of Social Work, Hines Community College, and as a parent mentor for low-income single mothers. Welcome, Andrea. Thank you so much for making time to be with us here today. So why don't we just kind of start and say, what do you want most for anyone listening in or viewers to know about Child Protective Service system within Mississippi? What's it about? What's it like?
Linda, thank you first for hosting this call and giving me this opportunity to talk about some important things that are going on in our agency, and also to kind of educate the public on what our role really is and what it's like here at CPS. I walked into an agency that was severely understaffed, and the pandemic certainly did not make that better. But we are in an agency that we've been under a lawsuit for 17 years in Mississippi, and the lawsuit really focuses on foster care. So while it has raised awareness in the state about the need for smaller caseloads and more intentional work, placing children in safe environments, I think that it has detracted the state from moving forward in focusing on what I think is a really important part of this work, and that is prevention work, preventing child abuse from happening, using data to tell us where that's likely to happen or where families are vulnerable, and in preventing removal of children from their biological families where possible. There is a lot of data out there, including a really good article by the Journal of the American Medical Association that talks about the benefit to children of staying in their own home if possible. If not possible, really intentionally looking early in the first days that they come into custody to find those persons who are connected to them. Might be a cousin, an aunt, could be a coach or a Sunday school teacher. But the outcomes for children are markedly better when we search diligently and early and identify those right fit placements and keep siblings together. Once they come into custody, the focus then really needs to be on keeping them in custody only as long as absolutely necessary. The fact is, state government is always going to be a poor substitute for family. So we want to be the best substitute we can while they're here, but we don't want them in our custody a month longer than necessary.
It's so multifaceted because you talked about prevention and primary prevention, if at all possible. And then you were talking about secondary prevention. And then when a removal does need to happen, for it to be connected with someone that the child or the young person really knows, that they already have a sense of connection with. We also know that when we're thinking about neglect and abuse across the country and in this state, that sometimes the neglect is an area that really tell us more about the economic part of neglect and how that works. Because it's not always willful neglect, is my understanding. So would you talk about that a little bit?
Yeah, roughly 70% of the intake calls that we receive are really about poverty. And, we all know it's not a secret that we have widespread, profound poverty in Mississippi. And it translates into the quality of life for children. So, a mom that's working 3 jobs and is a single parent, her options of who to leave the children with at night. Is the 8-year-old in charge? And is he the one cooking supper? Those are often, those are not reasons necessarily in and of themselves to remove children from custody. If there's a lack of an appropriate bed in the household, or the children don't have warm clothes, it is so much less disruptive and less traumatic for the child and less expensive for Mississippi to invest on the front end in that family and help them stabilize, if whatever the problem is. In the end, when we keep children in their families, we reduce the amount of trauma, we reduce the time they're in the system, possibly by avoiding taking them into custody. But it makes sense across the board.
And so there are things with that individuals in the community could really step up, and many are, I would think, are helping to step up to provide some support to the social workers and case managers across the state within your agency.
Linda, there are so many resources in this state, and one of the things that's really been overwhelming in this position is that everyone is behind making life better for abused children. It is a universally acceptable mission. And so, that's a really great thing to walk into. I've worked in other agencies where, it's a little bit harder to advocate for the work that we did. The community of Mississippi really, really wants to help. I think the agency has not necessarily been able to leverage that in a concerted way very well. One of my goals in the next year is to begin to develop an intentional philanthropic arm, a foundation where private, nonprofit, charitable, faith-based communities can really begin to help meet real physical needs of families when they're identified at risk of children coming into custody. And so that, there's a church here in Ridgeland right now that has a bed ministry, and they collect donated beds and furniture and they take it to homes. And if we call them in Hinds County and say that we've got a family who needs 2 toddler beds so that their children can sleep safely there, or a pack and play or a crib, they've been really responsive. And I think that that's the sort of thing that we could leverage in a system across the state. I also think there's a lot of room for communities to step in around our social workers. We have not always enjoyed the most positive reputation publicly. And part of that is because the cases that the public really hears about are the worst of the worst. And part of it is
to make the news.
Yeah, absolutely. There's a lot of positive work that goes on in this agency. One nice, pleasant surprise was that I go across the state, I talk to employees, I talk to supervisors. I mostly meet people who are really, really dedicated to this work. They want to do child welfare. They love child welfare. We burn them out right now, the way the system is set up. And so that's our job, is to start to get the right number of workers in, get the caseloads to a manageable place, and set systems in place that help them do their jobs instead of expecting them to go around and find a doctor that will take care of the child and take their Medicaid. We're a state agency. We provide care for 4,000 kids. We can contract and leverage systems so that we have a system to deliver care for children.
You talk about going across the state and meeting with individuals in communities and within your own staff. Could you tell us a little bit about how you got into this line of work, both as your training as a MSW in clinical and then also your law degree?
You know, some of it was luck and timing, but I was general counsel at DHS and worked with the governor's office quite a bit in his early days in office over some program issues over there, and got to know some of his staff. And I guess that's how I got on his radar. But my clinical and life experience really, I was adopted at birth by a family that adopted 2 children thinking they couldn't have their own. And then 2 months after they got home with me, she thought she had the flu and found out she was pregnant with my little brother. And yeah, I grew up in a family where there was no trauma from being removed from my mother. I was very fortunate. I was a week old when it happened. And you know, there was never a point in time that I didn't know I was adopted. I went to graduate school right out of college to get a master's in social work. I thought I wanted to be a therapist. I discovered very quickly that I do not have the patience or the temperament to listen to individual problems and, you know, maybe make 2 steps forward and 3 steps backwards. I really, the thing that really motivates me is looking at the system that causes those problems and starting to impact it so that I might change those 2 steps forward for 200 people instead of 1 client. So, most of my work in social work was in mental health care with children and adolescents, or in the administration of those types of hospitals. And so I learned a lot about regulatory work, you know, how the mental health system works. One of the jobs I had, I saw probably 90% of my clients were children in the foster system. It was a child unit on a freestanding site facility, and we had children ages 4 through 12. Back then, Medicaid, there were no community-based services, so children came into what was supposed to be acute psychiatric care and stayed for often months with us. But it was eye-opening. These children always showed up with a garbage bag with their belongings, and it just broke my heart for them to walk in the door with their whole little world stuffed into a garbage bag. But I want children to have, you know, some pride in who they are and what they have. They are important people, and they can go on to be anything that they want to be. And the state should not inhibit that potential that they have. So I then, as you said, I got my law degree. I have a short attention span, I guess, and I love a challenge and I love school. So, you know, I've worked in the judiciary, I've worked in the just practicing law generally. And then I went to DHS and worked with big federal programs, you know, state plans and regulatory structures and policy. And it's just that culmination of all of that experience really has been ideal preparation for this work. I really, the one thing I've said to a lot of people, I never have been a commissioner before. I don't know of many people who have, but it, you know, I really felt unprepared when I walked in the door. But I do think that that combination of experience has served me well so far.
I'd love to hear you talk more about what happened last week at the legislature. What prompted this is when you were mentioning about children who are in foster care can do things and can have very positive outcomes. And the House bill, I think it was House Bill 1313 last week. Tell the audience some about that, please.
Mississippi did something really neat last week, and I hope that it will continue and see this through. We're supportive of and had put forward a bill to give scholarships to foster children. That as I was weighing the options for what we needed to really ask for at the Capitol this year, there's a group of an advocacy group for foster youth called Youth First. I'm so sorry, I always get this one messed up, but it's led by a woman who has lived experience, and she's just an amazing Samantha Callahar woman. And then it's a mechanism for foster youth and youth who have graduated through the foster system and are young adults to really come together and to join their voices collectively to advocate for foster kids. And so Senator Richard Bennett sponsored a bill, and it gives scholarships to up to 150 foster youth each year until it's capped at 900 in a sixth year. And then as they roll off, more will be awarded. So it'll be managed through the State Office of Financial Support. It will be handled like all other scholarships, so it should be fairly easy to administer. And the only requirement is that they've been, now the wording is still subject to change. You know, it's only passed the House and it should be in committee at the Senate now. But the idea is that if you've been in foster care even for a day, on or after your 13th birthday, and that you would be eligible for the scholarship. And it's designed for those kids who really stay in foster care and don't get adopted. It's not intended to exclude kids who did get adopted earlier, but we're talking about young people who end up going out at age 18 right now. This agency has really historically used a term called aging out, and it's used a lot in the child welfare system. It's a term I despise because it's used as if it's a disposition for those young people, and it's not. It just means that we're done with them. They finished our system and they're not a part of it anymore. They don't have any more of their needs met. They aren't any further along in life unless we make sure they are. So what Mississippi did last week, they unanimously passed on the House floor this bill. They named it after one of their colleagues, Senator Bill Kincaid, who actually had spent time in foster care as a young person and had, really, it was an emotional afternoon over at the Capitol. A number of our youth were there and were in the balcony, in the gallery. And I stayed around and visited with some of those folks afterwards. And there are just some amazing young people in Mississippi who have somehow survived, being moved through. Sam Callahar said she was in 17 different schools before she graduated. And in one school, they might be in, learning about the Civil War, and the next one they're in, the Roaring '20s. So there are all these gaps in her knowledge base. These kids have lived through tons of trauma. So making attachments and relationships and navigating, simple things in life are difficult for them. And then they're also just 18. So, I have a kid who's about to be 18 in June, and I think that kid's not ready to go out and take on the world yet. So, this is one step Mississippi took. It would include the total cost of education, and there's some language in it to incentivize schools to keep their dorms open for them over the holidays. It's a really comprehensive, well thought out piece of legislation, and I really hope it passes. But it was a big joint effort between a lot of people at the Capitol, and our agency was just there supporting it. So good day in Mississippi.
Yes, and so we do want to spotlight the good things that are happening out there. And it also speaks to the lived experience of individuals. And then not only what these young people have gone through, but being a voice and being an advocate for young people coming after them. That is just so absolutely refreshing. What are some of the current needs of Child Protective Services in Mississippi? You have mentioned a couple of those. We're talking about more community support, having a manageable caseload, etc. Are there other things that you would like the audience to know that would be helpful and beneficial to the agency?
We need social workers and related health professions. We can hire teachers, we can hire psychology majors, we can hire a criminal justice major. Social workers always welcome. We need master's level social workers. We need expertise in this agency, and we need capacity. And so this year we are on a major push to not only realign the agency and give people what I call winnable jobs. So break down the jobs into something that is trainable and winnable. So a little bit more specialization in some areas, but then really filling up the bucket. And in fact, hire up a little bit more than we think that we need so that we can shift the system while we do this and start to streamline some processes. We're hiring, we've gotten our salaries up a little bit higher. We're hoping that the legislature will support us in getting them up even higher. I've had nothing but warm reception about that. So I've got my fingers crossed there. But social workers come in making $31,900 right now. And that is just not, it's not adequate.
And it's not an 8 to 5 job.
No, we're paying them an 8 to 5 wage, or we're paying them an 8 to 5 salary, and they're doing a 24/7 job. And so it's predictable that they burn out right now. But they want to do this work, even in this tough labor market right now. There are a lot of kids coming out of college who feel passionately about doing just child welfare work. So I think that we can recruit. We're going to be working very intentionally to do that this year and to also retain more workers, and at the same time, reduce the number of children safely that are in custody. We have a backlog of children who've been waiting for adoption, and they're caught somewhere in this very complex legal process between a permanency plan has been made for adoption, but getting them through TPR and to adoption in the state is extremely complex. It is a necessary evil sometimes when all other options have been exhausted and the court determines that the child needs a permanent situation. So it can't continue to go on indefinitely, that, you know, we sort of get things stable a little bit at home and then it falls apart. So the court has to make a decision at some point in time, usually around 15 months, that that they're going to run a plan of a permanency plan of adoption. They almost always run a concurrent reunification plan during that time. So it does still give parents an opportunity to, you know, pull their lives together, because I do believe it should be very hard to take someone's child. You have a lot of rights and due process should be followed. So, you know, for all of our benefit, it should not be easy to take someone's child, but we shouldn't let an inefficient system slow that down when we have really followed those safeguards to ensure that we've tried everything possible to keep the child in their home.
Yeah. If there were like one or two takeaways from this, what do you want to make sure that the listeners in the audience really would be thinking about, and maybe have some action steps in addition to just pondering what we've talked about today?
First of all, it's a new day at CPS. We have a new approach, a new attitude. We're building collaborative teams, and that will take time. We are intentionally focusing on building a work environment that is welcoming and warm and nurtures employees who are going to then welcome families and children into their offices. Our goal over the next 3 years is to shift this agency from one of reactive, sort of regulatory type work to one of where we build a reputation that this is the place you go for help. It's okay to self-report and come in and ask for help without fear that we're going to take your child away from you, and that we're going to be a credible source of expertise that can help you navigate these family problems. Child abuse to me is simply it's one of the worst symptoms that a family structure is deteriorating. So it should say to us that there are a whole lot of other things going on there. We might need to take the child out immediately for safety, but we need to see what's causing that and see if we can intervene and change it. Drug and alcohol use has just escalated out the roof during the pandemic. Mental health conditions have deteriorated. And so I'm very hopeful that, as generous as the legislature has indicated they may be with me, mental health needs, we really need to take this opportunity to build out robust support for families for drug and alcohol addiction, prevent child abuse before it happens, or give children stable places to live.
Well, thank you so much for the work and the leadership that you were doing, Commissioner Sanders, certainly for the individual social workers and case managers all over the state who will be working 24/7 this weekend and are out there promoting safety and keeping children from harm. But also to think about, I would hope that our viewers would think about what you can do as an individual, but more importantly, as a collective of individuals within your community to reach out to Child Protective Services, to reach out to some of the agencies and say, what is it that we can do to help you and help support the work that you're doing? Because as we believe at the Children's Foundation of Mississippi, for Mississippi to reach its potential, we must really make sure that our children reach their potential. And thank you so much for being an important piece of children reaching their potential in some of the most devastating situations that are out there. So thanks again.
Thank you, Linda. It's always a pleasure to talk with you. We appreciate the
Okay.
Children's Foundation and its work.
Thank you. We appreciate that.